Hello, I'm Mindy Burback, Communications Director for Lincoln Public Schools.
And I'm Don Mayhew, Lincoln Board of Education member. We started a new series to help share what is happening at Lincoln Public Schools. This gives our community an opportunity to hear from our staff and board members and ask questions.
And every Friday before our Board of Education meeting, we will air a 30-minute recorded show at noon that highlights some of the work taking place across Lincoln Public Schools. And then on Tuesdays at 5 p.m. prior to the Board of Education meetings, like right now, we will answer some of your questions that you've sent in to us after the episode. If you have any questions during our live show, please type them into the Facebook chat and we will try to get to them as we have time.
Joining us tonight to help us answer some of your questions since our first episode on Friday are Associate Superintendent for Instruction, Dr. Matt Larson, and Associate Superintendent for Human Resources, Dr. Eric Weber. Matt and Eric, thank you both so much for joining us.
Thank you.
You bet.
Last Friday, we spoke with Dr. Joel and Dr. Rauner about the challenges of running a school district during a pandemic. We had several follow-up questions that came in from the LPS Facebook page. The first question I have here is from Lisa Merrow, and she asks, after yesterday's announcement of all the public positive cases this week at LPS, is it still the safest? Dr. Larson, let's start with you. The team holds weekly meetings with the health department. What has the conversation been around the latest numbers of positive cases in our community and whether it's safe to continue with in-person learning?
Thanks, Mr. Mayhew. That's a great question. And we know parents have that concern. And as you mentioned, what's really important is that we do meet at least weekly with the Lincoln Lancaster County Health Department. We discuss the current situation in the community, review our protocols, go over anything we might want to be aware of, reconsider, think about as we move forward. I think it's important that one of the things we've discussed is the fact that our school system is a subset of the overall community. And so to some degree, the cases within the Lincoln Public Schools will mirror that growth or decline that's occurring in the community. What we can control are those 7 hours when our students are in school and making sure that they follow all of our protocols. And I have to say, we're extraordinarily proud of our students and our staff. They're doing a great job following those protocols. You might recall, Mr. Mayhew, back early when we announced the plan, some members were concerned that our students wouldn't wear masks, for example, those face coverings. And boy, mask compliance has been really high. That hasn't been an issue from the youngest student to high school students. So our students are doing a great job of following those protocols, and that makes a real difference for us. And we in the health department also agree that school is a safe place to be. It's probably one of the safer places to be because for those 7 hours when students are in school, we can guarantee that they are following those safety protocols and precautions that need to be in place. The question is, what happens when they leave school? When they leave school, they get together with their friends, maybe at a friend's house. They have a sleepover. They do what kids do. Younger children may go to a daycare, and in all those places, then those protocols, those safety measures may not be in place to the degree that they are in school. And so it's a reminder that really for school to be a safe place, we also need the entire community to be a safe place and follow those protocols of wearing a face covering, maintaining physical distance when you can, washing your hands, all of these things, monitoring your own symptoms yourself are critically important for the entire community, just as they are for us when we're in school. But we're really confident that school remains a safe place for students and staff members.
When I was talking with Dr. Joel last week, one of the questions I asked him was, what could the community do to support the work happening in the classroom? And that was his response. We just need the whole community to follow the safety guidelines. And I appreciate you responding with that as well. Our next question comes from Sydney Melia. Are there steps you could take to mitigate the risk of teachers being in school, such as not having school 2 weeks after major holidays? Now, I know that this has been a concern for a lot of folks. Our position has been that our top priority is doing what's best for kids. And we know that this has been a very difficult year for our teachers. There's a lot of concern in the community and on social media about the effect that this year is having on our teachers. I know that this is something that we take seriously. Eric, what are some of the measures that we have in place to help reduce the risk of spread among our staff?
Yeah, we did talk at great length about that option in terms of returning back to school and when's the right time for that to happen. But the question is, would it really accomplish the goal of reducing the risk of spread if we extend that out any further? And again, it goes back to something that Dr. Larson mentioned. If they're not in our buildings, where are they, right? Well, they're out in the community. So when is that right time to bring them back? If they are in our buildings, we know that they're following those protocols that we've talked about. And that in and itself is reducing the risk of spread in our community and also in our schools. So that was an important factor as we thought about when is that right time to bring people back. And we're doing what we can in the schools to mitigate the risk. We think we've put into place good protocols. We are adjusting and tweaking as we meet with the health department. Occasionally, they will ask us to look at some data or to change something, and we do that in concert with them. But I think additionally to your question, Don, we are working individually with staff who request accommodations to see how we can meet their needs while helping them to continue to serve our students in our schools. Staff will have certain needs that they may have in terms of PPE. There could be other accommodations. Sometimes staff aren't able to work because of exposure or quarantine. And we're just trying to come right alongside those staff members and be a partner with them to help them to navigate those situations so that they can continue to do what they need to do in terms of the virus out in the community or their own exposures, but also continue to be able to serve our students when they're able to. And this is an ongoing effort. You know, we're going to continue to do what we can to reduce the risk of spread in our school by following just those 3 W's, right? Wear your mask, wash your hands, and watch your distance. It's really as simple as those 3 W's. But from an employee standpoint, we really are just trying to be partners with them to help them to have the accommodations and to meet the needs of our students on a day-to-day basis based on what's going on with them as employees.
I know you've been having a lot of conversations too with the president of the teachers union, making sure that we are hearing their concerns. Speaking of protective equipment, we have a quick follow-up question for you, Eric. Alinda Stelk on Facebook is asking if the district has considered providing teachers with N95 masks.
Not across the board. There are some environments and situations where an N95 may be more appropriate. For example, we have talked about situations where we might have a mask exempt student and an N95 might be appropriate. We also have had certain individual staff accommodations that have come in where a physician along with that staff member has made a request for additional PPE. And so we have worked with that employee and that physician to make those accommodations. And sometimes that is an N95, but we have not talked about N95s across the board.
Thanks, Eric. Matt, back to you. We've got a question from Cecilia Dennis, who asks, what can we do to ensure that our children have enough time to eat? I understand the protocols during the pandemic, as cleaning and disinfecting is a huge task, but this is leaving our children hungry and only time for a few bites. How are our schools working to make sure that students have enough time to eat during lunch with all of the extra cleaning protocols?
That's another great question, Mr. Mayhew. And here's what I can say, and I can say it from firsthand experience. I've been out in our schools during lunchtime, and in fact have helped supervise lunch in some of our schools when they've been short-staffed for whatever reason. And I have been incredibly impressed with how our building leaders and teachers have responded to that lunch issue. What buildings are doing is they're really increasing the number of people who help supervise and manage lunch. There are extra teachers in there, extra custodial support in there. They're being very efficient in how they work students through the lunch line, get them seated. They're going around and, handing out napkins and answering kids' questions and getting them things. And boy, the minute they're done, everybody's pitching in to wipe down those tables so that there's very little time in between. I would say, what I noticed was there really wasn't an issue. I haven't seen an issue with students not having sufficient time to eat. What's important, I think, is that if we have children, we encourage them to be efficient themselves, not to waste time, to get right through that line, sit down, don't socialize first at lunch, eat your lunch first, and then you can do your socialization aspects of lunch. But if there is an individual concern, what I would encourage any parent to do is to reach out to the principal and talk about the fact that your child maybe is is not having enough time to eat lunch. Because what I've seen in each building where this has occurred, if there is a student for whatever reason doesn't have enough time, our principals, our teachers care about each and every student, and they'll work with that individual student to make sure they get the extra time they need so that they have their lunch and don't feel rushed or stressed about it, and then get them back to class as soon as possible. So I think the buildings are doing a good job managing all of that cleaning and making sure there's enough personnel in place to make it run efficiently. And if there's a problem, reach out to the principal. But from what I've seen, it's really working quite well.
Fantastic. All right. I am not seeing that we have any other questions just yet. Dr. Larson and Dr. Weber, thank you so much for taking the time to talk with us today. To the folks who are watching, as Dr. Larson mentioned, these have been excellent questions. The quality of this broadcast goes way up when we have your participation and are able to respond to your questions directly. So please keep those questions coming, and we will do our best to respond. Be sure also to join us for our regular board meeting at 6 o'clock today. You can watch it on our website at lps.org or on the LNK TV education channel.
That's right. And you can join us for the LPS board update on Facebook at noon on Friday, December 18th. And if you have any questions you would like for us to answer, you can submit them on our LPS Facebook page or on our website, lps.org. Just click on the blue Contact Us button and click on Board of Education and just put in the subject line LPS Live Board Update, and we would be happy to answer those questions for you. And with that, thank you for joining us.
Thanks again to Matt and Eric, and good night.